Today we will discuss about acid reflux and heartburn. I've gotten tons of questions about the same. I did a video. It was a quick and short video on Instagram. And then I did a long in-depth video about the 4 very common culprits causing acid reflux, but people mistakenly take those hoping to fix their acid reflux. So I will discuss those things in detail on today's live. I hope you guys are able to get some value out of it. I'll wait a little bit before I start. Oh, by the way, it's my lunchtime. I got done with my surgeries, the procedures in the surgery center, and I ate an apple, and now I'm gonna enjoy my cashews. If you guys don't know, this is my standard lunch, apple and nuts. You know, sometimes I would switch my cashews with the almonds, sometimes walnuts, but apple I definitely try to consume once a day. Alright guys, I guess we should start. So if you're having heartburn and acid reflux on a persistent basis, there are a few culprits that we need to be aware of that we should try to minimize in our diet. Spicy foods, sour foods. Spicy foods would be hot sauce, green chilies, red pepper, basically anything hot that needs to be minimized. Sour foods would be citrus fruits, lemon, pineapple, orange juice, pineapple juice. Don't get me wrong, these are really healthy fruits. Citrus fruits are packed with vitamin C. Most of us are able to tolerate those, are able to reap the benefits of those, so we should continue doing so. But if you're having persistent heartburn on a regular basis, citrus fruits need to be minimized in your diet. Not forever, but for some time at least, letting the food pipe and the stomach heal themselves. So citrus fruits, spicy foods, 2 most common culprits when it comes to persistent acid reflux. So try to minimize those, and that should give you some relief. Alright, so we're going to talk about the 4 other common culprits. And if I had a penny, every time a patient came to me and told me that they have been having severe acid reflux and they've been taking apple cider vinegar or lemon water to cure the acid reflux. This is such a common scenario. In all of those patients, I will tell them to stay away or stop drinking lemon water, apple cider vinegar, and believe it or not, just this one tweak in their diet takes care of their acid reflux problem. It is very important to understand the difference between indigestion and bloating symptoms and differentiate that from heartburn and acid reflux symptom. Acid reflux, heartburn is when you feel the burning sensation in your chest. Sometimes you can have hoarseness of the voice. Sometimes you can have cough, which gets worse on lying down, because the acid then is coming and hitting the hitting your vocal cords and causing you to cough. So that is heartburn / acid reflux. Indigestion and bloating are when you have a lot of gas in the belly, likely caused by low stomach acid. So in those cases, apple cider vinegar and lemon water will actually benefit you. Alright, so people confuse heartburn and indigestion, bloating symptoms all the time. So the influencers that you've been following most likely have not told you to differentiate between these symptoms. Also, another important thing is sometimes the heartburn and the bloating indigestion symptoms can go together, hand in hand. If that happens, then again, you need to stay away from lemon water and apple cider vinegar. Alright, another common culprit, honey. Honey is great. I love it as a sugar alternative. 1 to 2 teaspoons in a day is great. It has a lot of antioxidants. It can help with your sore throat. It can help with your cough. It is good. It can help with your seasonal allergies, because the theory is that when you ingest that local honey, you are ingesting the pollens from the local flowers, so that helps body build up immunity to the pollens, and that helps with your seasonal allergies. And I've personally noted that benefit myself as well. I have pretty bad seasonal allergies, and local honey during the peak time of those allergies really makes a huge difference. Honey in some people with acid reflux can also give them some relief. However, in a lot of people, honey will cause worsening of the acid reflux, and that is because honey, it is high in sugar. Now, I'm not talking about artificial sugar. There are different kinds of sugars. Honey has 2 sugars, fructose and glucose, and high concentration of those natural sugars, even though those are natural, high concentration of sugar will cause you to have acid reflux. Alright, so common scenario, my patients come to me, they're drinking lemon water with honey in it in the morning, and first when I tell them that please consider stopping it, they get surprised because they've never heard that ever before. But anyways, when they do listen to me, they do see a difference. So try it yourself. I think you'll be pleasantly surprised as well. Okay, 4th one, mint. Mint is a common ingredient in a lot of things, including chewing gum, and mint is known to relax the sphincter between the food pipe and the stomach, the lower esophageal sphincter. And when that gets relaxed, when that opens up, the acid in the stomach can come and hit the food pipe and cause you to have that burning sensation. Chewing gum is actually great when you have acid reflux. It will give you immediate relief, because when you're chewing gum, you're creating saliva, and saliva's nature is that it is alkaline. And when you're ingesting that saliva, that alkaline saliva decreases the acid in your stomach and would benefit you when you're having an acid reflux attack. So that's that, about those 4 things. What else? I have a couple more minutes before my clinic starts, so I would like to utilize it the best. Alright, so what if you've done your lifestyle changes in terms of what to avoid and what to avoid, and you're still having acid reflux? Then there are some natural things that you can do to improve your acid reflux and heartburn symptoms. Ginger tea is one good option. Fennel seeds is another good option. I mentioned about chewing gum without mint flavor, that is another good option. Basil leaves in lukewarm water, that's another good option. Bananas really help also. Plain water sometimes will take care of some acid reflux also. When the acid is coming up and you put a neutral plain water, that will also curb down the acid reflux in a lot of patients. Alright, so if you've done the lifestyle changes, remove the culprits, try to do the natural stuff, still having acid reflux, now it's time to go to medicines. So simple things. First, you try Tums, calcium tablets, that can help with acid reflux. You can try Pepto-Bismol, the liquid antacids, that can give you instant relief as well. If that does not help, the next step would be trying things like famotidine, which are H2 blockers. So that will be another option. If that does not work, then you move on to PPIs, proton pump inhibitors, that is omeprazole, pantoprazole, rabiprazole, all the prazoles are the PPI family. Now this class of family, these medications are really good. Strong medications, no side effects over short term, few weeks to a couple of months, great. But these medications, the PPIs, are not supposed to be taken as candies forever. I see so many patients come to me from their previous GIs or previous doctors, and you've been taking PPIs for the longest time. That really needs awareness for that issue to be resolved. But anyways, that's my rant. PPIs can be taken over short term. These are very safe. Over long term, these can cause effects on the kidneys. It can affect your bones, put you at risk for fractures. So not a good medication to be taken forever. Alright, so you've taken the PPIs also here and there, and you're still having symptoms. And this is the time when you talk to a gastroenterologist. You will need to be checked for H. pylori infection, which is very common. 40% of the world has this infection, and this infection attaches to the stomach cells and produces tons of acid. When the stomach has too much acid, it is bound to come up and cause acid reflux. So H. pylori is a very common reason for acid reflux all over the world. That needs to be checked. Simple test being the first. You can start by doing breath test or stool test. If those tests come back as positive, get the H. pylori treated with triple therapy. The standard therapy would be amoxicillin, clarithromycin, and omeprazole. If you're not allergic to penicillin. Another regimen would be levofloxacin, metronidazole, and again omeprazole. So that's that. If H. pylori is positive, you get treated. If it's negative, then you likely would need endoscopy at this time. That means camera from the mouth, take a look in the food pipe and the stomach. It's a very common procedure, very safe. The risk of complications is extremely low, less than 1 in 10,000. So if you need it, you should go forward with it. And it can find out conditions like any stomach ulcer, any growth in the stomach, things like celiac disease, which means you are sensitive to gluten in your diet, and so hence and so forth. So that's that. It's almost time for me to head over to my clinic, guys, but thank you for listening, and I hope this was valuable. We'll try to do some more Instagram lives in the future as well. Thank you for all your shares, likes, and your comments, and thank you for your engagement, and thank you for all your appreciation. I appreciate you a lot. Thank you.